What is up? I hope everybody's having a terrific Thursday. We are back with another surprise live where I answer various comments and questions that I'm getting on my YouTube videos because, well, I don't have time to do all the typey. So here we are. Yeah. I think we got it all teed up. Sweet. Everything looks good. Awesome. Yeah, so we're just gonna kind of dive in. I'm gonna answer a few questions because I'm going to have to leave at some point in time relatively quickly here. So we'll touch base, review, and yeah, we'll kind of go through some things. So really some good comments, some good questions that I've gotten. Some people kind of with their comments on, say, like managing nausea and such like that with the GLP-1 medications. I've been on semaglutide for 2 months. I get occasional nausea. I found that it's actually worse when my stomach is empty. Yeah, I've heard that as well. Once I eat or drink my protein shake, I feel better. I also only eat small amounts. Eating sugar, even natural sugar from fruit on an empty stomach, makes it worse too. Yeah, so kind of when it comes to that nausea piece of things, I mean, there's a lot of, it's going to be dependent person to person and how you respond and what specifically works for you and that sort of thing. So a lot of variability from just that perspective, but finding ultimately what works for you. And I've certainly found that the empty stomach piece of things has been something other people have reported. And I think what's kind of going on there is that since the natural hunger signal isn't getting through, your body is kind of trying to do whatever it can to get some kind of signal saying, hey, we need to eat something. So yeah, it can be kind of related in that aspect of things. And then yeah, glad to hear the protein shake works. Eating sugar, I usually hear that people struggle with the fat side of it, but depending on how responsive and that sort of thing, certainly could be something else that's going on there. Person here, I made a post today. How do you stay motivated on the days when you feel like giving up on your weight loss goals? And they said, I reassess whether or not my expectations are appropriate. That is awesome. So important. My internal dialogue becomes more gentle. I seek support and give myself credit for all the things I'm doing that are positive and healthy. This approach allows me to correct my mindset quickly. For me, negativity fuels setbacks and defeat. Nailed it. I think for like 99% of people, that is exactly what occurs, is that when you're in a negative mindset, when you're beating yourself up, shaming yourself, you think it's going to get you up and going, and maybe for a short period of time it might, but you're ultimately going to come back to the same problem over and over again. Whereas if you treat yourself with kindness and respect and compassion, you can make much better changes and move in the direction. And it takes you and your self-worth offline. Like, it doesn't put it back and saying I'm a bad person. It's just whatever you're doing isn't working for you, and hey, we want to try and do better in some form or fashion. So yeah, I'm glad that you're looking at your expectations, kind of just seeing, what are we actually doing? Is this actually working? And no, I mean, that's going to help you to be so successful in so many ways. So good for you. That is awesome. I love to hear it. I have hanging skin. Where is the best place to inject? Good question. In reality, you want to find some place that has a little bit of fat tissue. And sometimes that hanging skin can still have it. The biggest thing is just kind of finding an area that kind of works, that you can kind of either pinch or have enough fat there that you don't necessarily need to pinch. Yeah, it really, I wouldn't overthink it. Find a spot that works on your abdomen and go from there. So, and then on my post talking about how 98% in reality are probably going to need to stay on this drug long term, just because the lifestyle piece of things isn't always going to work for you. Thank you for acknowledging that the lifestyle efforts won't be enough. If I hear one more person claim that obesity is a result of poor habits and that we need to change when we medicate and can maintain. if we stop the medication, I'll pop. In some cases, this is true, but so often we rounder people are eating healthy and exercising. We just have an appetite that doesn't end where it should, and pathologies that change how we manage energy. Beautifully said. That is like the definition of obesity. Yeah, it's not just eating less and moving more. It's not just, change this one thing and everything will be beautiful and hunky-dory. Like, there is so much that goes into it, and utilizing these medications helps and makes things a little bit easier on your journey. Yeah. So another person on Ozempic personality video. Best advice, don't do blow. Great video, you've got a sub. Awesome, love to hear it. And then someone's talking about differences in diets. I think the best diet is the one that you can do forever. You have to change what made you overweight to begin with. Until that changes, everything will fail. Yeah, oftentimes I see a lot of people and they're dragging their old lifestyle patterns and behaviors behind them and just expecting to keep the weight off without, kicking those lifestyle patterns and behaviors away and making new changes, right? And that can even be the case of new people in your life, who you're connecting with, who you are seeing, all those sorts of things. Those are all equally as important in that overall process. And so how you eat, what you eat, those are obviously going to play a role, but it's setting up your environment and working on the things that are going to help you to be successful, to change basically your identity in some respects of kind of what got you to that weight and how you kind of will make the changes to get away from it. On my video, can Ozempic cause mood changes? Commenter said, my husband says it makes me grouchy. Well, that, could be low blood sugars, could be that you're not getting some of your favorite foods. It's all possible, but hopefully things are going well in your marriage. So, another patient or another person on needing to stay on medication for life. So insulin resistance is why I will need a GLP blocker for life, not only for weight. My cholesterol and lipids were dangerously high before Tirzepatide and normal now. I don't want to be on a statin. I'm sure the statin I was previously on contributed to my insulin resistance and gave me severe pain, intolerable, while GLP-1s decrease inflammation and have an added benefit of decrease in depression and related anxiety. So the evidence around statins causing blood sugar issues, like, there is some evidence, but it's so infinitesimally small, and it's not even until we get to the high levels or high dosages that we kind of see it. And even then, it's like, I think it's like 0.04 of an increase in blood sugar levels. So it's like, it's nothing. It's just like a skiff, if you will. And the question is, if a patient is on a higher dose of a statin, are they on that higher dose because they're actually already more predisposed to prediabetes and having elevated triglycerides and lipids and that sort of thing? So I'm not entirely convinced that statins are, well, they're definitely not as bad as what people make them out to be. There's a lot of good benefits that come from them. But I can understand how people maybe want to link something as to being the reason, but it's likely a multitude of different factors that were overall contributing, everything from dietary patterns to activity levels and that sort. I'm glad it's working and things are kind of going in the different direction for you. So definitely keep it up. But yeah, always kind of looking at the bigger picture and what we're dealing with there for sure. So appreciate the comment nonetheless. What is this question? So on menopausal weight gain, I had been on HRT for 6 months, which helped my symptoms except for weight gain. I recently started Zepbound and my weight is finally dropping. I'm starting to feel well and hopeful. Well, that's good to hear. Glad to hear that you're getting that response and kind of moving in that direction. Yeah, menopause certainly can be a contributing factor and certainly can lead to weight gain. It does make the whole process of trying to lose weight a lot more challenging for sure. I'm on Adderall, Topamax, Contrave, and Orlistat. Holy crap. I just started Mounjaro 2.5. When should I expect to lose weight and how much? I don't have D2. I pay cash. I weigh 157 pounds and I'm 5'8". That's like a loaded question there. I have no idea without knowing what your current patterns and behaviors and stuff like that are. You're on a lot of different medications, so, and particularly for the weight management side. So I would be curious about really looking closer at your lifestyle patterns and such like that. And also 157 pounds and 5'8", like you're already at a pretty, I think that's actually, if I were to calculate that out, that's probably within almost the normal BMI range. So my big question is like, what are we looking for? What are we striving for? And yeah, there's way too much there to kind of give any kind of specific answer. Stop and Shop brand Andrew Tate. I get so many questions or like comments that just are so nonsensical, or maybe they make sense to somebody, but I have no clue what any of that means. Stop and Shop brand Andrew Tate. Okay, like cool, I think. Thank goodness for real doctors. Yes, thank goodness for good clinicians that are able to help and support patients. Yeah, it's huge. Which one doesn't cause hair loss? So technically none of them cause hair loss. The hair loss is coming from a lack of nutrients or a sharp decrease in nutrients and providing your body enough protein and that sort of thing. So it's not the drug directly causing it. It's kind of the sharp, almost sharp decline or traumatic decline of eating less and that sort of thing that the medication certainly could add to and bring on. And that's what's driving the weight loss versus any one of the drugs themselves. Individual asked on my Cagrisema video, would this one be approved for type 1 diabetes? So, I mean, great question. With the type 1 diabetes, it gets really tricky, and we're starting to use these medications a lot more off-label in type 1 diabetes. But people are always, it's always kind of tricky because there's a greater chance of low blood sugars, and as well in type 1 diabetes, you don't have any pancreatic function remaining for insulin control. So the main effect of the drug helping to regulate blood sugars is no longer present. Doesn't mean that the GLP-1 medications couldn't help on the weight management side and reducing cravings and stuff, but overall helping with blood sugars, they're not going to be super successful. As well, they're always concerned about like things like diabetic ketoacidosis and so on and so forth. So whether Cagrisema will get that indication or not, I mean, it depends. I'm doubtful that the drug company is looking to go and get it for it, but there's always a possibility. And yeah, it will likely end up getting used off-label possibly at some point. So, oh, and I love these. Commenting some more says, try the carnivore diet instead. Again, such a useful comment. Like just, oh, thank you. Like that's all I need to do is just do the carnivore diet. Like, oh my God, our prayers are answered and the obesity epidemic can be solved. Like it's mind-blowing in some cases, frustrating and mind-blowing, like really. So I'm not a big fan of the carnivore diet. Most people do it wrong, and they have a whole bunch of red meat and bacon and butter and lard, and out of all the diet plans out there that you could do, like even keto is better because they usually advocate for veggies. Carnivore is just, you're asking for trouble unless you're eating a lot of fish, and even then the fish you're going to get exposed to mercury. Like have some veggies, go outside, touch some grass. The carnivore diet isn't the end all be all. If it works for you to go low carb, more power to you. Personally, I like having effective workouts and energy and stuff like that, and carbs help me to do that. Plus carbs are delicious. And don't get me wrong, I like a good old steak every once in a while. But red meats and stuff like that definitely have some issues with raising your cholesterol levels and leading to a heart attack. So, yeah. So, Another individual, I have a question and don't know where to ask it. Is tracking calories necessary on a GLP-1 medication? I find it very triggering. In the past, it would cause so much anxiety and fear of restriction and going hungry that I would end up overeating or even binging. When I don't track, those urges go away. But I understand that a calorie deficit is needed for weight loss. Any advice? So you don't technically need to track your calories by any means. Generally, kind of a way to think about it is that if you're not losing weight and you're trying to, then we have an issue with calories. You're eating and consuming too much calories. And certainly you can kind of play around with your portions, find a combination of things that kind of work, and using things like your hand portions and other kind of measuring metrics and that sort of thing. So that can be one method to go about it that's not specifically putting your calories and everything you're eating into an app and stuff. In general, trying to implement strategies of just, getting as much protein in as possible, trying to increase how much whole foods that you're eating, all of those good things are all other ways that you can go about it and may lead to weight loss. If you're not paying as close of attention to your calorie intake, your weight loss is probably not going to be as fast. So it's kind of setting up that proper expectation of taking your time with it and knowing that you may not lose, a pound every single week, but it will come down if you kind of take things and work on them consistently and just pay a bit closer attention. But for a lot of people, sometimes what all we need to do is just incorporate a lot more whole, minimally processed foods, get away from the processed foods that are higher in calories and stuff. And kind of incorporating and doing those sorts of things. So it's doable. Can be challenging, but if it causes you more mental health distress than anything else, then I definitely don't recommend you doing it. Find a different way, play with some different methods. There's lots of different kind of tools and stuff like that out there. So yeah, you don't necessarily need to count calories or anything like that. Cool. What do you think about tesofensine? Tesofensine. Can't pronounce it. Anyways, I haven't looked into it enough. I know I think it's, God, I don't even know how long it's been around or what the deal is with it. I would have to do so much more research around it to kind of figure out the ins and the outs. But yeah, it's probably a video in the future here. Blah, blah, blah. Love your videos. I started my journey with Wegovy medication 3 months ago, and your videos have been very helpful. Awesome. I'm glad to hear it. What are your thoughts on intermittent fasting while on the medication? I mean, I'm not a huge fan of intermittent fasting. If it works for you, fly at her. Intermittent fasting, I always try to encourage people to increase your activity and, building muscle mass and that sort of thing. And intermittent fasting can have a negative or detrimental aspect in the fact of that. As well, I find that it often leads to binging and overeating because people will fast and then they get their eating window and then it's just all hell breaks loose, or they'll fast throughout the week and then on the weekend they play catch up and overeating and over consuming. But it's like any other thing. It's a dietary strategy, if you will, and if it works for you to skip breakfast or whatever like that, then go for it. In general, I find people that get in more calories and protein earlier in the day tend to do better in managing their weight and overall health, but it might not work for you. So yeah, if intermittent fasting is what you want to do it. Thank you for explaining this, Dr. Dan. For years, I've struggled to compete with non-fat, non-obese people in my life. People that don't suffer from obesity have no idea how lucky they are. It is a struggle to figure out your body's needs. And like addiction, I don't feel people who struggle from obesity and diabetes have a choice. I would 100% agree with you. Yeah, 100%. So what if I don't want to come off of it and I want to stay on the 1.7 milligram dose? Okay, stay on the 1.7 milligram dose. Like, you don't need to come off of these medications. Yes, there are people out there who say you should come off and stuff, but again, it's a tool in the toolbox. And if it helps you to maintain your weight and keep the weight off and you feel healthy and good and aren't having any problems with the medication, then stay on it. go for it. Yeah. Ba-ba-bum. Hey, so today I weighed in and down another 2 pounds. Will the doctor put me on a very low dose of Wegovy? Is it just as safe to stay on? Seeing a doctor who prescribed me the Wegovy in another couple of weeks. I mean, yeah, we've got long-term studies. We've got 20 plus years with these medications. Things look good. Yeah, I'm not concerned about it. It's going to depend on your doctor and the conversation that you have with them. So yeah. But I don't hear anyone talking about feeling achy and cold on Ozempic. Is it just me? So if you're feeling cold, or suddenly feeling cold while going on Ozempic, I mean, there's multiple things that we need to look at and stuff like that. But I have had patients report that to me, and part of that could be that they're eating very little now, and so much so that they're not giving their body the necessary nutrients, so their metabolic rate has started to slow down and that sort of thing. I've actually had a patient who was eating very, very low calorie, and we started to increase her caloric intake. And I can't remember exactly why she was taking her temperature every day, but she happened to be taking her temperature, and steadily we saw the temperature of her body go up by like a degree a week kind of thing. And it was coinciding with her eating and consuming more calories as kind of like her metabolic rate and how many calories and such that her body was burning. Was all going up. And the achiness, again, could be a nutrition deficit. I know a lot of people, there's tons and tons of information out there, and you would think people know and understand what is proper nutrition and how to, eat a nutritious diet and stuff, but it is shocking how many people do not. Terrifying in some cases. So yeah, that's kind of where I'd be looking and going from there. Is this guy the Peptide Buddy? He has the same voice. I don't even know who the Peptide Buddy is, but I would say it's a pretty good voice if you ask me. All right. It's just about calories. Eating less calories causes hormonal changes, especially lower carbs, as carbs release serotonin. What? It's just about calories, but then we talk about hormonal changes, and then we talk about carbs and carbs releasing serotonin. You literally contradicted yourself in that very statement. Like, I don't. And then are you saying that serotonin, because this is on my Ozempic personality video, like serotonin gets up into the brain from the gut, which we've proven doesn't happen, because serotonin from your gut, yes, there's serotonin there, but it helps to get you going shitting and stuff like that. And it doesn't cross the blood-brain barrier to get into your brain or anything. So, but eating less carbs, yeah, you'd probably be less happy. So maybe more of a serotonin issue or something like that. And hormonal, I don't know. This is, yeah, okay. As a diabetic and Ozempic user, I may suggest you explain to your viewers to fully read the instructions and also sign up for the Ozempic online support. Also, as per instructions, note that the pen has to be charged before the actual injection, and the pen is best held so the dial window is full view so the visual plus the sound is seen. I mean, at this point, we're kind of like splitting hairs. Like, it's almost like you watched the entire video and just looked for the one or two things you could pick out and make a comment on. I appreciate the comments and kind of what you're talking about. And charged, I think you were talking about priming, which I covered in the video, but cool. I mean, again, semantics, splitting hairs at the end of the day, and overall isn't going to make or break kind of how the injection is done and such. And then the Ozempic online support group, I've heard, yeah, not so much good things about it, but thank you nonetheless. Saxenda, my Saxenda video. I've just started Saxenda. I'm super excited about it. My doctor has said his patients are quite successful on it with no serious side effects thus far. I'm a healthy eater and trying to exercise. I've made a whole lifestyle change, but just need this to boost things along in fat loss. I'm hoping to just need it 6 to 12 months to reach my goal. So going into this with kind of a short-term window and perspective on it is a good recipe for failure. because 6 to 12 months is a pretty short window, and likely you're not going to develop a fully solidified good set of habits and patterns. And yeah, once that medication is removed, likely the weight is going to go back up. Yeah, I usually don't kind of put like a timeline or time frame on it, because now we're looking at a sprint versus the marathon of trying to do this over the course of our life, and that can be certainly very problematic. Yeah, that's kind of just my thoughts there. My doctor will prescribe it, but my insurance won't cover it unless I'm on a diet program first for 3 months. Well, that's stupid. And you've probably been on a diet program multiple times for 3 months at a row. Like, that's okay. I mean, that seems to be the new hoop. I am starting to see that kind of thing on some special auth forms. It's really a pain in the butt. So when it came to fatigue with Wegovy, helped my new diabetes, diagnosed A1C, went 7 to 5. My perceived problem was that I didn't lose any weight. I didn't lose any weight for almost a year. And then I started taking MCT oil and eating an avocado a day and lost 24 pounds in a month and a half, and which was awesome. Then I couldn't find Ozempic anywhere and I didn't the med for a month. So I'm getting back into gaining about 4 pounds back, which is fine, but the unrelenting fatigue that I go through is crazy. I thought it was me. I didn't know others had the tissue issue as well. I do have a lack of motivation and some depression with anxiety and depression issues before. Okay, that's a lot to unpack there. 24 pounds in a month and a half is terrifying. And if that's all you were eating in a day, also terrifying. Again, we need to really look at this from a whole perspective of this is a marathon and looking at our whole life, and not just something that's kind of quick and wham bam kind of thing. Yeah, I don't even know what to say to that, to be honest. Let's see, what else do I got here? What happens when you stop taking Mounjaro? Does all the weight come back and more? That is my concern. So for a vast majority of people, yeah, the weight is going to come back. There's some people, a small percentage, about 10 to 15%, that can keep the weight off long term when they come off the medication. They are people who have made a full 180 in terms of their lifestyle and have really dug in and made some really big changes. So it really all kind of is going to be dependent on you and what changes you make and what kind of changes you can sustain long term, that are going to decide how well you do in terms of keeping the weight off if you come off the medication. You also don't need to come off the medication. There's nothing that says you do. Yeah, no concerns, no issues. So cool. I haven't taken Ozempic and I have gastroparesis. However, I'm a severe case of type 2 diabetes. I wonder if metformin was involved. If you have a severe case of type 2 diabetes, the gastroparesis is likely the case of due to your diabetes. Yeah, especially more severe diabetes, the higher and longer that your blood sugars are elevated, are going to lead to autonomic dysfunction in your nervous system, as kind of like we get peripheral neuropathies and stuff like that can happen in the autonomic nervous system, lead to things like gastroparesis. I've even had patients who it's affected their ability for their heart to control their heart rate, and we've had to use medications to bring their heart rate up. And yeah, it's quite significant what poorly controlled diabetes can do to you. While taking the medication, is it possible one could have a drink or two of beer? I mean, you're always allowed to kind of do what you'd like. There's nothing wrong with it. There's no contraindications to metformin, Ozempic, or anything like that. I mean, I'd be mindful of it. I find some people, when we get the slowing of gastric emptying, alcohol sits there for longer, they absorb more of it, and that could certainly lead to getting drunker, if you will. So yeah, just being mindful of that piece of it and going from there. My insurance covered it. Play the dryer. That's funny. So what about using this as part of body recomposition? Do folks who are weightlifting and prioritizing protein keep the weight off when coming off this medication? Can this safely be used as a bodybuilding show prep to reduce body fat for the stage? I mean, I certainly wouldn't recommend it for that. I know it's actually being banned for natural bodybuilding competitions and stuff like that. And I believe it's on the banned substance list with the Olympics and such, because yeah, it does help with losing weight and kind of giving that competitive edge. No doubt that the bodybuilding scene is using it and stuff like that. I usually don't recommend it as a tool for like body recomposition. Like if that's just specifically what you're going for, is just trying to gain muscle and manage the fat, just because if you're trying to eat a lot of protein in much higher amounts because you're training at a much higher level, the drug is going to make it very challenging to eat a lot of protein and get the calories you need and stuff. Yeah. I appreciate you showing this video, but it seems like nobody is talking about how much or how many clicks you need with the dosage. I had to Google how many clicks because there are no numbers to tell you the dosage. If anyone needs to know, 0.25 is 19 clicks. Yeah, I mean, some of the pens, unfortunately, with Wegovy and that sort, counting clicks, there's kind of an equation that I do for calculating it and stuff like that. I can't remember it off the top of my head. I'd have to write it down. But yeah, that's kind of one of those pains. And then someone responded to you, oh, the same Diabetic and Ozempic user. I suggest you fully read the instructions and also sign up for the online support. Oh, some people are kind of irritating. My God. Bum, bum, bum. What do we got? Thanks. My pleasure. Oh, this looks like a good one. This podcast is just psychobabble about calorie deficit to lose weight. He completely ignores the role of Ozempic and the plateau, which comes after use and why it happens. He says to just reduce the overall calories consumed. That's hardly helpful at all. Ozempic works by increasing insulin secretion from the pancreas, which in turn allows sugars and carbs to enter the cells through receptors. The real question, which he completely ignores, is why does that hormonal process stop working after taking Ozempic for some time? What? Yeah, you need a calorie deficit to lose weight. I don't understand what you're talking about with insulin from JM08050 to break through a plateau. Yeah, you have to get into a calorie deficit. It's how your body loses weight. No one's saying it's easy, and I'm pretty sure that's what I said in the video, but okay. And yes, Ozempic works by increasing insulin secretion from the pancreas, which in turn allows sugar and carbs to enter the cells through the receptors. Well, technically, the carbs and sugar don't go through the receptors. They go through the channels that are created after insulin is bound to the receptor, but again, semantics here. Why does that hormonal process stop working after taking Ozempic for some time? Okay, that's where you lost me, because insulin, are you trying to say insulin is the thing that's causing it? I don't know. Yes, I mean, these drugs, Ozempic, Wegovy, and stuff like that, can increase insulin levels, but perhaps insulin is not the end-all be-all that everyone makes it out to be, and is not the reason why people are gaining weight and unable to lose weight. Your body is very smart in what it does and stuff like that. And yes, insulin is a building or an anabolic hormone, so it can build fat, it can build muscle, it can build all those things. But your body stores and uses your calories based on what's available. So if there is excess calories available after we've topped up the muscles, the brain, the heart, and that sort of thing, whatever calories are remaining are then going to go and get stored in your fat cells. If you're in a calorie deficit and we top up everything else and such like that via insulin, and we still need calories to keep the body functioning for our basal metabolic rate and stuff, it's going to go preferentially to your fat cells and utilize the fat to then pop up whatever calories you're lacking and missing. And yes, Ozempic and such like that continues to increase insulin, and yeah, I don't fucking know. That just makes my head hurt. Oh, Jesus. After decades of research and billions of dollars, this is the best we can do. Did Ozempic have long-term issues in it, and still they want us to pay such prices? They say it's due to cost of the research. Right, sure, okay. Considering Mounjaro, but doubt I'm really going to do it. Pharma makes money on BS lies with no accountability. Nice scam. I'm going to recommend to you their Recart one, perhaps writing some letters to your Congress people and government officials rather than yelling on the internet. And then after you write those said letters, go outside and touch some grass. Okay, cool. Dude, almost failing a course, and the way you joke about is very entertaining. Tell me, why should I trust you? Because I'm the best of the best, obviously. Gosh. Thanks, very informative. My pleasure. Sweet. All right. I think that's enough for now. Holy crap, I've got a few questions here. I'll quickly answer some of these bad boys. Solo H. So, do you recommend any specific blood work while on Ozempic? Been on it for almost 3 months, down 23 pounds, 0 side effects, and currently at 0.75. You do amazing work and so much appreciated. My pleasure. Thank you. I mean, there's always kind of monitoring. So my general panel, every 3 to 6 months, I usually have patients do check end organ function, make sure liver, kidneys, everybody's all happy, hunky-dory, check lipids, anything in particular that might have been out on the initial panel. We want to take a look and see if those are starting to correct, inflammatory parameters, that sort of thing. Lots of different things that we may look at and try to pick apart. So yeah, it really kind of varies person to person, but like end organ function, liver function, kidney function, A1C, lipids, CBC, those are kind of the main ones, unless there's something else that comes up. So yeah. Kimberly, am I less likely to lose muscle on Mounjaro if I was strength training for decades before starting the meds? So not so much. I mean, you'll have a good base of muscle, but if you don't continue that strength training and continue consuming a good amount of protein, you're still going to lose muscle mass ultimately. Yeah, it's not going to be necessarily preserved because you're still creating that calorie deficit, still trying to ultimately lose weight and such. And yeah, generally we lose, it's kind of like a 2/3, 1/3 ratio. 1/3 comes from muscle, 2/3 comes from fat, but that varies person to person. And there's really no evidence in terms of like weight training leading to a more permanent level of muscle and such. Good question though. Are you able to prescribe SG? I'm assuming semaglutide, maybe. Yeah, I prescribe it. I rate like multiple prescriptions per day. Sometimes living with binge eating disorder and morbid obesity is about harm reduction. This has been a lifelong battle. It's not possible to give 100% effort to it every day. 110%. There is no way to give it 100% every single day. That's just the reality of being a human being. Like, you do the best that you can. Some days are going to be 50%. Some days are going to be 100. Some days are going to be 80%. The goal is just to keep showing up and doing the best that you can every single day. Dr. Dan, you're an amazing man. The diet culture is a toxic place. Your channel information is so useful and so enlightening. People truly don't understand the lifelong struggle weight issues are. Amen to that. Thank you very much. I appreciate that. Any idea why neither Saxenda or Ozempic neither worked for me at all? Depends what you mean by not working. Is it you didn't lose weight? Did you get appetite suppression? I have a video coming out next week. But the week after, talking about Wegovy non-responders. So lots of questions to ask, and hopefully some of your questions might be answered in that. Today, my doctor said Mounjaro. What have we got? Today, my doctor recommended Mounjaro as treatment for sleep apnea, lose weight, reduce apnea. Yeah, so a new study came out. I actually need to go through that study. But Mounjaro, I think, got the FDA approval for managing and treating sleep apnea, reducing the weight and pressure on your chest if there is no structural abnormalities or anything like that. Certainly can help to reduce sleep apnea and be an effective treatment. So yeah, cool. That's awesome. Hopefully no issues with coverage and stuff. All right, we've been here for a while. Lots of great questions. Love you all. Have a terrific rest of your Thursday. We'll be back randomly when I can, doing these lives and stuff, trying to do them a bit more consistently. But as always, appreciate the support. Of course, keep sharing with your friends, family, and everybody in between. And yeah, have a great Thursday, everybody. We'll talk to you later.